Just wanted to take a few moments to review with you some possible corrections for the SOAP note correction assignment that you just completed. So many of you recognize this problem or correction was that there was no problem statement. So many of you attempted to write a problem statement instead of just writing no problem statement was included, which I commend you for doing that. Um, One thing I want to point out though is that for a problem statement, you want to make sure you're concentrating on an occupational area or a performance skill deficit and not the diagnosis. So the concentration of that statement should be either an area of occupation or a skill. As far as your S section, um, first of all, you're not giving any context. Who said these statements? So things like client stated or the client stated, and then the quote when asked about such and such. Many of you also pointed out that the top few quotes are not really necessary. They're not really relevant. So eliminating all but that bottom quote that's highlighted in blue here is probably best practice. You could probably tie some in depending on what it is that you're talking to your client about, but the most relevant quote would be the one down at the bottom. So adding the context to that, client stated, I don't like doing this therapy. I don't see any point in continuing it. I don't ever make progress. When asked about continuing therapy or when asked about coming to therapy 3 days a week. Okay. So that provides some context there. So then your O section, one of the things that was missing was the date of service. Many of you recognize that and added that, but you want to put the specific date. Then where was the client seen? So not just in the clinic, you want to say, in the OT clinic or in the treatment gym or in the client's room. Okay. Then you also want to talk about why you provided treatment. What did you work on? So then this first sentence, patient appeared to be anxious during the first part of the session. Appeared to be anxious is a judgment or an opinion and not a measurable observation. Then the patient's anxiety hindered his ability to perform the required tasks. That statement is more of an assessment statement because, again, it includes your professional judgment or your professional opinion. So it should be included in the A section or the assessment section. In the O, you would include what you observed that makes you say the client was anxious. So, did the client constantly shake his leg, or did the client fidget with his clothes and was unable to pay attention to what you were saying? That kind of thing. Things that you can actually see are the things that go in the O, things that are measurable and observable. Then the patient did not seem like he wanted to participate in therapy today. Again, this is not measurable. What did you see the client do during the treatment that leads you to this conclusion? Then he became tearful when he spoke about the hobbies he used to engage in. So other than becoming tearful, what did you observe? Did he cry? Did he grimace? What did you observe in that process when you were talking about the hobbies he used to engage in? So being specific about what you saw. Then in your A or your assessment section, your opening sentence should restate the problem. Then after that, you're going to talk about what you're going to be working on in therapy as they continue services, if you recommend continued services. And when you do that, you need to make sure that the information that you provide in the A is also discussed in the O. So again, remember, no new information should be included in the in the A that is not already in the objective or the O section. You also want to look at when you're looking at your assessment section, you're going to be including sentences similar to the patient's anxiety hindered his ability to perform. So that's a great statement for this client. So his anxiety hindered his ability to perform. Let's say you wanted to talk about his work preparation. We'll just take one of those activities. Patient Patient's anxiety hinders his ability to perform work tasks successfully. And then you can go into what it is that you feel like he needs to do with continued OT to improve that area. So I hope that makes a little bit more sense as to what goes in the A. Then you finish your assessment section or your A section with what is the client's rehab potential. Now, some potential words for the rehab potential or the prognosis of the client is excellent, good, fair, or poor. Okay, you want to try to avoid poor and fair because if their prognosis for therapy is poor or fair, then number one, insurance is going to question why you've got them on therapy, and number two, why would you keep somebody on therapy if their prognosis or their potential to improve is poor? So just be mindful of the verbiage that you use there. Then with your plan, so you're going to begin the plan with continue OT, and then you're going to include the frequency, which is how many times per week, and the duration, which is how many weeks. Now, when you're doing your frequency, please do not say daily because daily implies 7 days a week. And majority of therapy clinics, outpatient, inpatient, most places do not offer 7 days a week of therapy. Even if there are therapists on staff 7 days a week, typically they do not offer therapy to the same client 7 days a week. So you want to make sure you specify how many days and not just stating daily. Then your plan is going to include what you're going to address. Are you going to work on leisure pursuits? Are you going to work on the IADL of meal preparation? What is it you're going to work on in future sessions? And then how? What are you going to do to improve in that area? Whatever that goal area that you state, you need to also state how you're going to improve in that area. So maybe if you're working on meal preparation, one way that you might improve that is by having the client participate in a cooking group where they actually will cook a meal. Then you want to make sure that at the end of your plan that you're including a collaboration with the OTR statement. So this plan of care was created in collaboration with the OTR. You want to make sure that you include that because you are being supervised by the OTR, and it's important that the person reading the note knows that the OTR is involved in the planning of that patient's treatment or that client's treatment. Then the final thing I want to point out is when you sign your name, you need to make sure that you include your credentials as well as the date. So a signature line is more than just signing your name. It also includes the date and your credentials. I hope this helps to kind of clear up um, what we were expecting with the SOAP note correction assignment. If you have any additional questions, please feel free to let me know. We want to make sure you guys really understand SOAP note writing and the basics of it because next term you're going to be working on writing a few SOAP notes based on some videos and things of that nature. So we want you to be comfortable before you get to that point. So if you have any other questions, please feel free to let me know.